deeper, you find more stuff. And that's the relevance of deep tissue work. Unfortunately, deep tissue has become synonymous with aggressive, painful manual therapy, which it really shouldn't be. It just means accessing the deeper tissues. And again, if you work layer by layer, particularly using that kind of pumping, mobilizing, stretching the tissues, using whatever techniques you're used to using, myofascial release, soft tissue release, whatever methodology you're using, but go down at a layer that the nervous system is happy with. We talk about never exceeding 4 out of 10 on a pain scale. So it's a strong enough to be effective, but light enough to be pain-free. That's our Goldilocks zone. Kind of 3 to 4 that the person says, I feel it, you're on it. There's maybe a little bit of sensitivity, maybe even discomfort, but not pain. I talk about this in my book, actually. I talk about, what are the key indicators? Because people have different kind of perceptions of pain. Sometimes you'll have people going, oh, that's like a 4. And you're going, that's a lot more than a 4 if you have that kind of response. So we talk about, well, what are the recognized markers? So it is about what the person says. That's a valid subjective interpretation of their pain. But then there's objective responses as well. So there's things like the person flinching away.